Talk to you a little bit about how this Explorer, the sequence for using the Explorer. And we talked about this already previously in our last discussion. And we talked about the fact that this is the functional shank. This is the terminal shank. The shank that's closest to the working end. Here's the working end. This is the terminal shank. And the shank, the more twists and more turns and the longer it is, enables you to place the instrument in different parts of the mouth and different parts of the tooth. So it's designed for being able to gain access, because some explorers, especially like the ODU that we talk, the Orban, it's not always feasible to use that in a lot of places in the mouth. So we're always going to look for this first bend. And so there's the terminal shank that I have colored in black. So there's the first bend, okay? And anywhere you place this, and here's a bend here, and here's a bend here, okay? But this is your visual clue. So in any sextant, whether I'm buccal or lingual, or anterior, or lingual of anteriors, I'm always going to look for that first bend, and it's always going to be distal, okay? So I'm going to take this instrument and I'm just going to pick it up like I would, and I'm not necessarily picking it up in any rhyme or order. I'm just picking it up because that's what you would do on your bracket table. You would pick it up, because when you lay them down, instruments, you don't lay them down knowing that's my terminal end or that's my working. You just don't do that. You just lay it down. Then when you pick it up, you find the correct end. That's why you see clinicians will move the instrument and flip it and so on, so that they'll find the right end. Okay, so I'm going to find this first bend, and so if I place it right here, if I want to start on the lower right buccal, you can see that that bend is not going distal. It's pointing to the mesial. There it is right there. So that's incorrect. Now, I could probably make that work if I go around like this, but then when I bring it around and I flip it, you can see what that end does. See that working end right here? It's just scooping straight out. So that is not going to be able to adapt. So by flipping it, this has to be my correct end because that's the only other one I have to choose from. There, the bend is going towards the distal. So you stand it up between two teeth, okay? And this is how you determine. So the terminal shank is standing straight up and down, okay? And I'm going to start with the lower 1/3 side of the tip, okay? And I'm going to work it and walk it using my wrist only, not my fingers, into the distal surface of that molar, and it continues to stand straight up and down. That's as far as I can get. We never back out. We always the point are the headlights. Pretend like they're the headlights of the car. So the only way that you can go if you're driving this car with these headlights, that's the point, is to go this direction. You never back your car up like this, okay? Especially if you're going on a rounded road, and this is our rounded road here. I'm just trying to give you an analogy. You're never going to back it up. You always follow the direction that you're going. I'm going distal, and that's where I'm going. It's as far as I can go. I'm going to pull out. Okay, now I'm going to take my instrument, and now I need to go this way. So now I'm going to flip my instrument, flip the tip. I'm going to go right back where I started on the line angle, and I'm going to come around like this. I need to move my fulcrum back. Come around like this, come around like this, and you see how that working end, because I have the right one, curves perfectly around the roundness of that molar, okay? So if this end is the one that works for this lower right buccal, this end is going to work for the lower left lingual, here and here. Okay, so